Namaste. Now let us understand about Three Cycle Program. The test tube baby process was a technique started almost 35 to 40 years ago. But today, most of the patients who undergo test tube baby process face two main problems. The first is the success rate of test tube process, which is only 30 to 40%. That means after undergoing this treatment once, 3 to 4 out of 10 women conceive a child. The remaining 6 to 7 women have to undergo the treatment again. In few cases, a patient undergoes this treatment 3 to 5 times. Now the expenditure inflates with the number of times the treatment is taken. In our country, the expenditure for one test tube baby treatment is around 1 to 1.5 lakh rupees. If the treatment is repeated 3 to 5 times, the expenditure goes as high as 5 to 8 lakhs. The second problem is there is no 100% guarantee of the pregnancy. The research so far indicates that after getting a treatment of 3 times, 70 to 75% women become pregnant. This leaves 25 to 30% women who, despite going through the treatment 3 to 5 times and spending lakhs of rupees, still don't conceive. Now, if there was any insurance cover for the treatment, it would have been much easier. But today the situation is that there is no insurance policy or government aid which covers the expense for the test tube baby treatment. This expenditure is to be incurred by the couples themselves. After considering all these issues, we came up with the Three Cycle Program for test tube babies. What happens here is, every patient deposits 2.5 to 3 lakh rupees, which includes the cost of 3 treatments. After going through this program, after undergoing 3 treatments, 70 to 75% women become pregnant. And in the case of remaining 25 to 30% patients, half of the money is returned to them. So one can say that the patients who successfully conceive help the unfortunate patients financially in a way. This financial aid helps those patients to get the further treatment. Otherwise, one has to start all over again right from gathering the necessary finances. This is as good as any medical insurance in that one who doesn't get the successful treatment gets the refund from the money of those who conceived successfully. From a doctor's point of view, the advantage is that in the case of women who couldn't conceive in the first treatment, we can check all the analytical data of the female eggs, sperms, how the embryo was, how the uterus lining was, etc., which makes it easy for us to identify the problem in the pregnancy. And we can work out, plan, and improve the next treatment accordingly. So by this fine-tuning methodology, we can improve from cycle to cycle over various factors and increase the success rate. So this all is about the Three Cycle Program.
अपॉइंटमेंटसाठी कॉल करा 99 22 432 972 किंवा भेट द्या www.ivfcare.in. आजच संपर्क साधा.